Hey everybody, thanks for joining us today and checking out our video. I'm Josh Robbins with Amplify. We are, of course, your hands-on expert financial team that's dedicated to helping you grow your business. Recently we've been bringing you guys a lot of content about all the financial impact of COVID-19 and how to put the right strategies in for your business. And today we're going to continue that. This is going to be a two-part video series, and we're going to be focusing on insurance and benefits and all that fun stuff that businesses need to keep going and to keep their employee bases happy and healthy as we move forward through these crazy uncertain times that we've got going on. We're not insurance experts, and so fortunately though, we've got some great partners in that space with Marsh McLennan Agency, and so I'm really happy to welcome John Holland with us today. John, thank you so much for joining us.
Thank you for having me on, Josh. It's a pleasure to be here and looking forward to our conversation.
Great, excellent. So tell us a little bit about Marsh McLennan. Who are you guys? What do you do? What do you specialize in, and how can you help other companies?
Sure. So Marsh McLennan Agency is a full-service insurance brokerage firm based here in the United States, solely focused on mid-market companies here in the United States. We are a wholly owned subsidiary of Marsh, which is a part of the greater Marsh McLennan Companies umbrella, which includes Marsh, Mercer, Guy Carpenter, and Oliver Wyman.
Excellent. So one of the things that we've been doing, John, is we've been producing a lot of content out there about, the financial impact and what's happening. And, COVID-19 has rocked our worlds, right? We don't know what's up and what's down. And so we're trying to stay on top of this information for everybody. So from your side in your world and living in insurance and benefits and everything that Marsh offers to companies, what are you seeing? What's been the impact, and how is this really affecting business owners?
Yeah, and great question, and it's crazy. It's important to note that things are changing on a daily basis. The information that we know today is very well outdated information tomorrow. But being a part of MMA and the greater MMC organization, we've had people and teams that have been tracking the coronavirus impact all across the country and all across the world. So we get insights really with a feeling like you have your finger on the pulse with this, which has been great. But since the pandemic first broke, we've been tracking the impact on employer health plans here in the United States, and we've been able to identify some areas of concern or some areas of exposure that we think both fully insured and self-funded group health plans will face both now and in the future. Now, we can't say for certain that any of this will actually be the case because it's still too early yet to tell. But we have identified a few areas that we think are areas of exposure for both fully insured and self-funded health plans.
So what do businesses need to be looking out for in those areas? What are some of the things they need to care about, and should they be concerned about of what's coming down the pipeline here, what we're seeing?
Well, so in the immediate term, employers can definitely see a decrease in emergent and elective surgeries. So people are just pushing that off. They're waiting to go to the doctor's office until it's safe again. You can see an increase in telemedicine utilization and as well mental health services, just as people are shifting the way they go about receiving the care that they need. Telemedicine has increased substantially since this pandemic first broke, for good reason too. Employers can also see an increase in pharmacy fills. So pharmacy utilization is likely to go up as their employees and their families are refilling their prescriptions early, avoiding any unnecessary trips to the pharmacies, etc. And then one of the other ways that companies are seeing a decrease in cost would be through ancillary services. So people are not going to the dentist or to their ophthalmologist as frequent as they used to. They're maybe postponing those semi-annual visits till next year, or until they think it's safe again to get back into the office.
So that's interesting. I heard a lot of ups here, downs here, this may shift and this kind of thing. And so when you start to plug all that stuff in and look at it, every year everybody expects health insurance costs to go up, right? We always, that's in the back of everybody's brain, whether that's true or not, in the marketplace, like we anticipate that that's going to happen. And as we go into third quarter, which for a lot of companies starts their process for the renewals of what they're seeing, with all this shifting up and down and different prices, and some things we're using more of and other things we're using less, what can businesses expect to see going forward in terms of their health increase, the health benefits, the cost of those increases, decreases? What are we seeing in the marketplace?
Well, this actually may come as a surprise to most, but in the near term, employers can actually see a decrease in costs. And that's because their employees just simply are not seeking and receiving the care as they used to. People are afraid to go to the doctor's office. They're postponing those non-elective and emergent services to the future. So in the near term, it's quite possible that employers actually see a decrease in claims utilization. And now how that impacts the renewal is another question. We've got a great tool that I think we'll talk about here in a little bit that is helping employers kind of navigate, and budget for the renewal and the renewal process. But down the road, we would see like an increase in those elective surgeries that people have postponed, so that pent up demand, if you will, people start coming back and reusing those services. Employers just need to keep in mind, the population, the employee population that they have, the demographics of those employees, where they reside, the risks that they're exposed to within those, denser, if they live in a denser MSA, so a denser city where the risks are higher for exposure to COVID-19, things like that. So there are some swings to it, but in the near term, certainly a decrease in cost.
So it's hopefully a decrease going down, which is going to be good coming out of this situation, because a lot of businesses are suffering economically, and sales and everything have gone down. We know a lot of people have been impacted on that front. Potential though that swings back up and maybe goes up a little bit higher as that pent up demand, and then hopefully after that balances out, and gets back to a state of normalcy after hopefully we get this under control and we move past the major impact of the virus. So I know that we've been seeing a lot of support coming out from the government. A lot of different packages have been coming out, and we at Amplify have done a lot working with companies on the different relief options, from the payroll protection programs, the EIDLs, Main Streets, state stuff, and we've spent a lot of time focusing on that. But one thing that Amplify hasn't touched on too much is on the Families First Act, which really impacts a lot of the employees and how companies deal with them. So what have you been seeing come out as a result of that bill, and what's been the impact of that and the lasting, and where's that going right now?
Well, I feel like our compliance team has just been overworked and underpaid with all that's been coming out, because there's just been so much in such a fast period of time, and both the IRS and DOL are issuing guidances daily on how employers should address certain leave laws and things like that. So there's been a lot that has come out. Two things that I really want to hit home on, though, that I think employers need to pay attention to are certainly the 2 paid leaves that were created with the Families First Coronavirus Response Act. That's the emergency paid sick leave, and then the public health emergency leave, which is an extension of the Family Medical Leave Act. The IRS and the DOL put these leaves together with the intention that if an employee was more like at risk or exposed to coronavirus, that these leaves would help mitigate the spread of the virus, because these employees would then be at home, away from the virus, away from any threats to themselves or their families. So that's really an important part to note, is that these leaves are intended to actually mitigate and reduce the spread of the virus. The emergency paid sick leave is a 2-week paid leave, and the emergency public health leave under the Family Medical Leave Act is an extension of the FMLA, which is a 12-week paid or partially paid leave.
So impacts there, different things, benefits that employees can take advantage of. Yeah. It sounds like there's some great plans in place as well for the companies, some things that they can do to help protect themselves, and that this act sort of paved the way and gave a little bit of help and assistance on there. Yeah. You touched on just a minute ago, speaking of help and assistance and resources. I know you mentioned you introduced a tool, something that you guys have. What's Marsh McLennan got that companies can take advantage of to help them during this time to plan for this stuff?
Yeah, it's a great question. Something that I'm really proud about. Our compliance team, actuarial team, all of our teams at MMA have worked very hard on this financial impact model. With just a small amount of information from the employer, we're actually able to forecast and model out, based off different scenarios, the cost impact of COVID-19 on their health plan. So as we were talking about kind of the swings, the ups and downs in costs, with their census, we can actually narrow it down to the county-specific infection rate that their employees live in. So we can identify, based off where their employees live, the risks that they're exposed to, which is really cool, and something that we update almost weekly with new admission rates, new infection rates, as more data comes out. And that's something that is free of charge. which is great. Being a part of the MMC umbrella, we're able to provide all these tools and resources at little to no cost, which is awesome. And really standing by our motto, which is being there for the moments that matter. And this is certainly one of them.
Sounds like a fantastic tool. Excellent organization to go out and get a lot of help. When you're talking about projecting these costs and everything, that's near and dear to our heart because we focus very much on businesses' finances and where they're at and controlling their expenses and putting those right projections. Our last video was just about that, about what are the right projections and how do you view that. So that's fantastic. John, thank you so much for the information. I appreciate you being here. We're very proud to be partnered with Marsh McLennan here at Amplify. If you want more information, you can always get in touch with us at the email address at the bottom of your screen down there, connect@amplifygrowth.com. We're going to put some information on how to get in touch with John and Marsh McLennan down in the description of the video. And don't forget to subscribe to the channel so you can stay on top of all the latest information that's coming out from Amplify and from our friends at Marsh McLennan. Until next time, stay safe out there. Thank you very much, everybody.
Thank you.